So let us start. 185 to 203 actually deals with the local disease with the external application, whether external application is justifiable or not, and in which cases these external application can be justifiable, we will discuss. So 185 to 203 deals with two topic actually. One is local diseases. Okay, there the concept of local disease we have discussed in previous two classes. The concept of local disease, if it has not been originated by severe injury, okay, and without any injury. If there is a little injury and external manifestation is there, that means that disease is of internal kind, which is giving its external manifestation. Okay, so 185 to 203 is dealing with the two topics actually. One is external disease and other is external application. Okay, we in homeopathy we use external application in some cases. What are those cases? We will discuss as it comes. So 190 we have finished up to 190. Today we will discuss 191 onwards. Effect of suitable homeopathic remedy on internal malady and general health. This can be heading of this aphorism. Okay, effect of suitable homeopathic remedy on internal malady and general health. Okay, although you are giving the medicine on the for patient have consulted you for the external disease, but when you are giving medicine, the patient will report that they have been benefited with some internal symptoms also. That is what it is dealing with. Now this is confirmed in the most unambiguous manner. What is unambiguous? Without any doubt, by experience, which shows in all cases that every powerful internal medicine immediately after its ingestion causes important changes in the general health, okay, of such a patient, and particularly in affected external parts. Okay, in general health and the part affected, which the ordinary medical school regard as quite local, quite isolated. Even in so-called local disease of the most external part of the body, the change it produces is most salutary, being the restoration of health of the entire body, along with the disappearance of the external affection. You can underline this line: restoration of health of entire body, along with disappearance of external affection, without the aid of any external remedy, provided the internal remedy directed towards the whole state was suitable, chosen in a homeopathic way, homeopathic sense. Underline this: the medicine you have selected, you have directed it towards the whole disease. The case I have shared, you must remember that it was the eruption on the chest, okay, and it has gone, and the patient have suppressed, and then patient developed diabetes, again came back to me, I started the internal medicine again, and that eruption came back, and then with the time that eruption faded away. When you will say that it has completely faded away or cured, only when the color of the skin is same all around, color of the skin in the patch and other areas becoming same, then only you can say that you have cured the external disease. Okay, so-called external disease. When a local disease you are treating with your internal medicine is called cured, when the color of that patch is matching with the color of other part of the body, then only you can say it has been cured under your treatment. Okay, until and unless color don't return, the local disease is still there. That means the internal disease is still there. 192, selection of suitable remedy. Okay, selection of, so how you are going to choose internal medicine. Okay, that is the case taking of local disease. This is the best affected when the investigation of the case, underline investigation, dealing with the case taking. You will see that aphorisms of case taking in different sections also. Apart from in general case taking, you will see the aphorisms of direction regarding case taking in intermittent also, in mental disease also, in local disease also, in one-sided disease also. Okay, so this aphorism is basically dealing with the case taking of local disease. Investigation, underline investigation, then along with the exact character of local affection. Underline this, exact character of local affection. All the changes, sufferings and symptoms observable in patient's health. Underline this, symptoms observable in the patient's health. Okay, local affection is here the chief complaint. It is called, Robert have called it, wrap of the fabric. Any chief complaint. Patient may come to you with the headache, patient may come to you with gastralgia, patient may come to you with a rheumatic affection of the knee joint. This is actually the chief complaint. Okay, and chief complaint, Robert have told it, wrap of the fabric. Okay, patient will more and more focus on it, that I have this, don't ask me anything else, don't ask me about bowels, about my urine, about my sleep, I'm not concerned about that, everything is fine, just treat this headache. Okay, that is why it is the wrap of the fabric and you have to open it, and that is why the case taking is very important aspect in our homeopathic treatment. It is called half cure, until and unless it is not a one-sided disease. Okay, until and unless it is not a one-sided disease, you will get some other symptoms also. So here local affections is the chief complaint of the patient, and patient will go on narrating that Dr. Babu, पानी निकल रहा है इसमें से, पस निकल रहा है, ब्लीड हो रहा है, इस वक्त ईच करता है, उस वक्त ईच करता है, यहाँ से वहां फैलता है. These all are local affections. Okay, you have to note it, that if it is towards yellowishness, if it is the scaling of psoriasis, if it is moist eczema of meserium, okay, if it is orange towards orange color of cicuta, like that. Okay, so local affections, the chief complaint. Note the chief complaint. Underline local affection, all the changes and suffering previously noticed, the symptoms observable in the patient health and which have been previously noticed. Underline previously noticed. Okay, so what you are going to take in in investigation of this, local affection, symptoms observable and symptoms previously noticed. Okay, when no medicine had been used, are taken in conjunction to form a complete picture. Underline complete picture of disease. Before searching among the medicine whose peculiar pathogenetic effects are known, that is proved medicine, for a remedy corresponding to totality of symptoms, so that the selection may be truly homeopathic. Okay, underline complete picture. That's it in this aphorism, case taking of local disease. Okay, next 193. By means of this medicine, which you have selected, what we are doing in homeopathic case taking, we are trying to form the symptoms and trying to match the symptoms with the medicine. Okay, this is we are doing, this is the process of this is our third business, applying the medicine. This was knowing, first business, this was knowing the materia medica, second business, and this was application, this is third business. So by means of this medicine employed only internally, and if the disease be but of recent origin, often by the very first dose of it, the general morbid state of body is removed along with the local affection, and later cured at the same time as the former, providing that the local affections depend solely on a disease of the rest of the body and should not be regarded as an inseparable part of the whole, as one of the most considerable and striking symptom of whole disease. Underline this, most considerable and striking symptom of the whole disease. Though the whole body is diseased, but most considerable symptom, striking symptom which the patient is narrating to you is that local affection. And after your medicine internally, okay, after your medicine internally, the disease, all the morbid state general morbid state removed, or start to heal, or the patient starts to feel better. Okay, now 194. Now this is external application. Regarding external application, it is not useful either in acute local disease of recent origin or in local affection that have already existed a long time. Acute local disease. Can you tell me some acute local diseases? Acute local diseases, can you tell me?
Any injury, sir?
What?
Injury.
I cannot hear you.
Any injury.
Any injury? Injury, the obvious local disease. Injury due to injury, and there is no local means there is no severe local affection. If the injury is heavy, the part is affected heavily, then that is obvious local injury, local disease. Okay, but a little injury and there exists a gangrene. Okay, that is that cannot be called local disease, because there are the something internal which is maintaining that. Okay, so injury is correct answer. Anything else?
Acute exanthema.
Exanthema usually not a acute disease. Boils, cannot you remember boils?
Boys, rankles.
Okay, boils. Urticarias. Okay, urticarias,
Yes, sir.
allergic reactions, sudden itching, sudden rashes. Okay, you will find people going in sun and coming back with the red rashes. Okay, what is this? This is acute sunburn. Okay, in this condition, cantharis is helpful. Okay, acute, you can call acute burn we have discussed that urticarians is one of the medicine for burn. In the last class we have discussed for burn, we think of usually cantharis, but cantharis, more than cantharis, urticarians is more useful than cantharis. Okay, as lotion, as gel for acute burn. Keep it in your patient's kitchen. Whenever the patient burnt himself, ask them to apply urticarians and there will be no blisters. So it is not useful either in acute local of recent origin or in local affection that have already been existence. So regarding this acute injury type, vulnerary remedies of Roberts, in Robert you will find a term mentioned, vulnerary remedies, those remedies which are being used in injuries. Okay, so in acute injuries you can apply local application, you can give local application like calendula for cut, arnica mother or gel, arnica lotion you can apply for bruises, urticarians for burns. Okay, what else? So these few remedies you can apply for acute type of injuries, vulnerary remedies. Okay, uh, now or that have already existed long time ago, to rub in or apply externally to the spot of an external remedy, even though it be specific and when used internally salutary by reason of its homeopathically, even although it should be at the same time administered internally for the acute topical application, inflammation of individual part, erysipelas, etc., which have not been caused by external injury of proportionate violence. This we have discussed again and again. So you should not apply. There are 2-3 conditions for external application, like only external application prohibited. Okay, external application with the internal application of the same medicine prohibited. Okay, you cannot give. Okay, only external application of the similimum cannot be given. Okay, so no external, as far as you can give your internal medicine, no external application is advocated in homeopathy. Reason, can you tell me some reason why Hahnemann is barring external application? Any reason?
It will be suppressed, sir. It shows the internal
Even if similia,
malady.
even if similia is there, like you are thinking that I have, there are in market sulfur ornament available. Even if similia, that by case taking you are coming to sulfur, okay, and you are giving sulfur externally and sulfur internally. Even if it is similimum, you cannot give. Why?
Mm.
You will get answers in next aphorisms. Now, please read from here. Where I have left, please read from there.
Um, from here, which have not been caused by external injury or proportionate violence, but
Yes,
by dynamic
yes.
or internal causes, yield most surely to internal remedies homeopathically adapted to the perceptible state of the health present in the exterior and interior, selected from the general store of proved medicines, and generally
Underline
without
this.
any other aid.
Underline this. General store of proof remedies. Underline this. Now, in footnote, Hahnemann mentions aconite, rustox, belladonna, mercury, etc. Okay? Aconite, rustox, belladonna, it's okay, but mercury is antisyphilitic medicine. Still, Hahnemann is advising to use it in acute cases. You will get this type of phrases in intermittent disease also, and in mental disease also. What we call no acute disease. पहले acute आया तो tackle the acute and then start the treatment for chronic. Okay, so what are acute remedies? Hahnemann have discussed at several places that first give acute for some violent nature, acute disease of violent nature in mental. Go to mental disease and you will find that general class of proof remedies again mentioned there.
221.
Okay, in the bracket 221,
Aconite,
aphorism number
belladonna,
221.
stramonium.
Other class of proof remedies, same thing. General class of proof remedies, other class of proof remedies. In sometime Organon examiners confused you with what is other class, what is general class. This is nothing but the theoretic medicine in homeopathy. Okay, they are same. They are same. But in different condition, acute medicines are different. Here also you will find mercury, hyacinthus, okay, stramonium, belladonna, aconite. These are acute medicines, you know, but again mercury is included. Okay, underline other class of proof remedies and then aconite, belladonna, stramonium, hyacinthus, mercury, and etc. By nature of their symptom, it is given. Okay, hyacinthus was not there in skin disease, but it is mainly the acting on the mental sphere. Stramonium mainly acting on the mental sphere. So acute medicine for mental disease, acute mental disease. Okay, now go to this intermittent. You will again find the same thing for acute. Other class of proof remedies again 243, 243, 1, 2, 3, 4, fifth line. Other class of proof remedies. Got it? Got it?
Yes, sir. Yes, sir.
Okay. Underline that. Other class of proof remedies. These are same thing. What is general class of proof remedies? Plain answer should be non-antisoric. Underline non-antisoric. Okay, that is why mercury is included there. Not antisoric. Okay.
Yes, sir.
Now come back to that aphorism.
Mm. And generally without any other aid. But if these diseases do not yield to them completely, and if there still remain in the affected spot and in the whole state, notwithstanding good regimen, a relic of disease, which the vital force is not competent to restore to the normal state, then the acute disease was, as not infrequently happens, a product of soda which had hitherto remained latent in the interior, but has now burst forth and is on the point of developing into a palpable chronic disease.
Relic of disease, underline that. Relic of disease, a decorative phrase you are getting for your writing in your examination, a relic of disease, underline that. If your general class of proof remedies was unable, you will often find that general rashes, okay, uh, blister, red rashes like that, or sunburn will yield to your general class of proof remedies. I usually general type of general rashes where people come to me for general allergic rashes, okay, red rashes like dermatitis, like acute dermatitis, which usually yield to rustox, arsenic, cantharis, like these medicines. But if it is not yielding to these arsenic medicines, you have to know that this is a relic of disease which is remaining, and this is a palpable chronic disease. During the course of lecture on our SORA, we have discussed how SORA actually developed. SORA first, latent stage. There is SORA in the latent stage, and some at some point of time, due to some accessory circumstances or due to some causation, that SORA is coming, means will be bursting out. If the patient health is if the patient's vitality is strong, where that SORA will come? That SORA will come at the external part. Okay, if the health is strong, vitality is strong. If the vitality is not strong, so here the vitality is strong, that is why the SORA is on the surface. Okay, that is latent SORA is on surface. You will not get the primary symptoms of SORA nowadays, because everyone has got infected with SORA and everyone is having the SORA in latent stage. Okay, and some poking up will stimulate the SORA to come in secondary stage. Okay, I hope you are understanding or remember that lecture of aphorism number 73. Aphorism number 73. Remember
Yes,
that?
sir. Yes, sir. Yes.
Individual exciting cause and individual disease causing transient explosion of latent SORA. Explode kiya SORA. Now, if you give your general class of proof remedies, even if you are not giving under improved condition of living, that SORA is supposed to calm down itself. Okay, transient explosion of latent SORA. Okay, now that transient explosion under improved accessory circumstances and your general class of proof remedies, that SORA is supposed to calm down itself. Okay, completely. Now if it is not calming down, it is like remaining like this. Okay, now this is what? Palpable chronic disease. Okay, this is what? Palpable chronic disease. There it has been discussed in the reference to acute disease on the skin, but you can say it in any kind of uh, chronic disease. Okay, palpable chronic disease due to explosion of latent SORA which failed to calm down itself under your treatment or under improved condition, under improved accessory circumstances. Okay, then what is that? This is a relic of disease. Okay, now this relic of disease you can use in phrase in connection with the acute miasm also. We have discussed this, that after acute miasms they are leaving something. What is relic? खंडर. एक there was a building, बम गिरा, वहां पे अब क्या है? एक निशान है कि वहां एक बिल्डिंग था. खंडर, मलबा जिसको बोलते हैं ना, व्हाट इज कॉल्ड रेलिक. एक निशान बच गया, वहां एक बिल्डिंग था. ओके, दैट इज अब पूरे तौर से क्लियर नहीं हुआ वो जगह. दैट प्लेस हैज नॉट बीन क्लियर्ड टोटली. ओके, दैट इज रेलिक, malba. Okay, that relic of disease you can use in connection. Here Hahnemann have used in connection of acute disease, acute skin disease. Okay, that relic of disease phrase you can use in the connection of acute miasms also. Chicken pox hua tha, chala gaya. What are those spots? Those spots are relic of disease. Okay, टाइफाइड हुआ था, चला गया, हेयर फॉल स्टार्ट्स. व्हाट इज दिस? relic of disease. जाते जाते it had left something, that yes, there was something which have been left uncured. Okay, so in cases of acute miasm you can use those medicines, okay, like typhoidinum, malandrinum, to clear that land. Okay, to clear that land, malandrinum, typhoidinum, morbillinum, and even streptococcine for severe acute infection of throat was there. Even staphylococcine, streptococcine, like these nosodes are helpful in clearing those relic of disease. I have narrated a case of parotidinum where there was a person suffered from mumps in his teens, and now he is having low sperm count. Okay, we know that mumps affect the mumps actually affect the sperm counts. Okay, if the patient is have suffered in in adulthood of their life, mumps suffered from mumps, it will going to affect the even you will get azoospermia. Okay, so parotidinum, by knowing that history, parotidinum 50 m 10 m and 50 m was prescribed, and it was all count was in the next 2-3 months count was normal. So what was that the clearing the relic of disease with the acute miasms nosodes. Okay, so this is the concept behind the using nosodes of acute miasms. Okay, that are often very helpful. It is not necessary that every acute miasm will leave the relic of disease, but yes, it is there. Often you will find that there are relic of disease which is hindering your malba hai to वहाँ पे there is relic, it is hindering your simillimum to go smoothly to that. So first clear that relic and run your medicine. Clear? So here relic of disease and palpable chronic disease. Now 195.
In order to effect a radical cure in such cases, which are by no means rare, after the acute state has pretty well subsided, an appropriate antisodic treatment, as is taught in my work on chronic diseases, must then be directed against the symptoms that still remain and the morbid state of health to which the patient was previously subject.
Underline this. Symptoms which still remain and the morbid state of health which patient was previously subjected. Underline this. Often you can use in acute miasmatic diseases also. Dr. Babu, typhoid जब हमको हुआ था, when I have suffered typhoid, I was having a burnt test in mouth. Okay, you can use this burnt test for your prescription. Now patient is having hair fall, too much hair fall, too much weakness, all this relic of disease. But during typhoid fever, this was my state. Okay, during that malaria, this was my state, that I was suffering from chill in lower extremities only. Okay, you can use that symptom for your simillimum also. Okay, next.
In chronic local maladies that are not obviously venereal, the antisodic internal treatment is, moreover, alone requisite.
Alone requisite.
Requisite.
Okay. Next, why a Hahnemann is telling accepting venereal? Why accepting venereal here?
Venereal includes syphilis and psychosis.
Why is accepting this venereal? Go to aphorism number 282. 282. Sixth edition footnote. 282, sixth edition footnote, last paragraph. 282, footnote, sixth edition, last paragraph.
Since diseases in general are but dynamic attacks.
No. Last paragraph. That is second paragraph, last paragraph, third paragraph. Experience, however,
teaches that the itch plus its external manifestations, as well as the chancre, together with the inner venereal miasm.
Shankar is also included here. क्या बच गया? Psychosis. This is a fifth edition. That is of fifth edition. This is sixth edition. At that period of time, maybe Hahnemann was having concept of applying local application in venereal chancre also. But here in the sixth edition, he's telling that no, chancre is also not needing any external application. But next, Pahit.
Together with the inner venereal miasm can The
You are
fig
not
words.
audible.
If
Hmm. Again, please read it again.
Sir, am I audible?
Yes, you are audible.
Can and must be cured only by means of specific medicines taken internally. But the fig words, if they have existed for some time without treatment, have need for their perfect cure, the external application of their specific medicines as well as their internal use at the same time.
Okay. So figwort, which have been existed there for some time. Okay. It is called inveterate warts in chronic disease. Inveterate wart. INVETERATE. Warts. Large figworts which have been existed before, existed for some time, need their external application of what? A specific remedy. If you are giving thuja, you can apply thuja. From where the this external application for what's is coming. Okay, lay practitioners, every now and then people are using, even common people are using thuja for externally for what's. Okay, so in what's external application, Hahnemann is telling that external application is needed for those kind of what which have large jagged and existed for some time. Okay, now anagalis is also one of the medicine. Open boric, I have no boric here. Open boric anagalis. Anagalis. Do you have boric with you?
Yes, sir. I'm searching for
Okay,
it.
please open
Mm,
anagalis.
yes, sir.
Okay, read it.
Marked action on the skin characterized by severe itching and tingling everywhere. Favors expulsion of splinters, an old medicine for hydrophobia and dropsy. Possesses power of softening flesh and destroying warts.
Yes, underline this. Possess power of and destroying
Softening
what?
flesh and
Okay.
destroying.
Underline this. And it has also marked power of, we used to prescribe silesia, but anagalis is also one of the medicine for splinters. Okay, silesia in low potency and anagalis also in low potency, that is 30 or 200 may be given. But when it is in the fauces, means in the throat, something is there, anagalis usually means anagalis is more helpful than silesia. Okay, when there is something externally, silesia is more helpful, like in finger, in toes, or in soles, there are silesia is more helpful. And when there is something, fish bone is stuck in the throat, anagalis is more helpful there. Okay, so anagalis, two uses of anagalis is there. Externally, you can use it for warts where you are giving thuja and not getting relief. But I think anagalis works better than thuja mother tincture. And that splinters, for the splinters, this anagalis is very helpful medicine. Now 196, 196.
It might indeed seem as though the cure of such diseases would be hastened by employing the medicinal substance which is known to be truly homeopathic to the totality of the symptoms, not only internally but also externally, because the action of a medicine applied to the seat of the local affection might effect a more rapid change in it.
More rapid change, underline this. Okay, it might be the Hahnemann is giving justification in first edition of Organon. Go to appendix, you will see that. Go to appendix of 196. Got it? Appendix to 196.
Yes, sir. The first edition
Second
has, it
reference.
seems, instead
Hmm.
of the remainder of the paragraph as we find it there, the first edition has, seeing that the local melody generally strives to isolate itself, though it cannot do so completely in the living body, and that medicines are observed to produce a more rapid effect on the seat of their application than on more remote parts.
See the footnote here.
The injection of cherry laurel water into the anus of animals shows its spasmodic action first in the lower extremities, later in the upper parts, and on the upper parts first when it is introduced into the stomach.
Okay, when it is given by mouth, the affection is firstly at the hands. Okay,
Mm.
upper extremities. When it is given by anus, the means action is first in the
Lower.
lower extremities. So if this can be justifiable, that if you are giving your medicine at the seat of disease, it will more rapid. Okay, this is one of the point which can justify the application of external medicine, similimum external medicine at the site of affection. But go to 197.
This treatment, however, is quite
This treatment, which
inadmissible.
treatment? Which treatment?
External application
This treatment means external application of similimum. Okay,
mm,
this treatment.
is, is quite inadmissible not only for the local symptoms arising from the miasm of Sora, but also and especially for those originating in the miasm of syphilis or psychosis. For the simultaneous local application, along with the internal employment of the remedy in diseases where chief symptom is a constant local affection, has this great disadvantage that by such a topical application, this chief symptom, local affection, will usually be annihilated sooner than the internal disease, and we shall now be deceived by the semblance of a perfect cure, or at least it will be
Underline this.
difficult in.
Underline this. Uh, from here, by such topical application, this chief symptom will usually be annihilated sooner than the internal disease, and we shall now be deceived by semblance of perfect cure. Chief complaint is gone. Now you think that you have cured
Cured the
it.
cure.
Okay, underline this. This is one of the disadvantage of that. Next.
Or at least it will be difficult and in some cases impossible to determine from the premature disappearance of the local symptom if the general disease is destroyed by the simultaneous employment of the internal medicine.
Okay, it you will be in confusion that if the general disease have been cured or not. Okay, now 198. Chief complaint will be gone sooner than the internal disease. Okay, if chief complaint is not there, which what will guide you? That is why I have told no that external disease is not cured until and unless the patch, the color of the patch and other part of the skin are same. Okay, that is our guide. Next 198, 198.
The mere topical employment of medicines that are powerful for cure when given internally to the local symptoms of chronic miasmatic diseases is for the same reason quite inadmissible. For if the local affection of the chronic disease be only removed locally and in a one-sided manner, the internal treatment indispensable for the complete restoration of health remains in a dubious obscurity. The chief symptom,
Underline
the local
dubious
affection, is
obscurity.
gone.
Dubious obscurity.
The chief symptom, the local
Chief symptom
affection,
is
is
gone.
gone, and
Underline
there
this.
remain only the other, less distinguishable symptoms which are less constant and less persistent than the local affection, and frequently not sufficiently peculiar and too slightly characteristic to display after that a picture of the disease in a clear and peculiar outline.
Okay, this is obvious. Next 199.
If the remedy perfectly homeopathic to the disease and not yet been discovered at the time when the local symptoms were destroyed by a corrosive or desiccative external remedy or by the knife, then the case becomes much more difficult on account of the too indefinite, uncharacteristic, and inconstant appearance of the remaining symptoms. For what might have contributed most to determine the selection of the most suitable remedy and its internal employment until the disease should have been completely annihilated, namely, the external principal symptom has been removed from our observation.
Underline external principal symptom has been removed from our observation. That was the case that you were able to see the external disease, but here the disease external local affection have been removed by application of ointment or by application of knife, with using knife. It has been removed. Now you are not able to see its characteristic features. Okay, what 192 was telling, the characteristics feature of local disease is not in front of you. Okay, that had been removed from our observation. Okay, now so it will become more difficult in such cases. Okay, if you have not discovered the simillimum till then, the patient is coming to you after removing that external application. Now it is difficult because that was local affection of one-sided nature usually, and there are less distinguished symptoms. Chief symptoms have been removed from your eyes. Okay, so this is 199. Up to 198 it was dealing with the external application of medicine with your internal
Similarly,
with your internal medicine. Okay, that external application may be of two kind, maybe of similar medicine, or maybe of any other medicine. Both are not advocated. Now 199 is telling that patient is coming to you after having removed that external application, external symptoms,
manifestation.
local manifestations. Now it is difficult for you to find out the medicine because the chief symptom have been removed. Okay, now this 200 onwards is dealing with the bad effect of suppression. Okay, if this local affection is derived internally by local application or knife, what will happen? We will deal from here in next class onward. Any question you are having, you can ask.
Sir, in sixth edition, Hanuman favored external application now.
In sixth edition,
Sixth edition.
in particular case, aphorism number 282, sixth edition, footnote, you will see that there is inveterate warts, or that warts which have been existed for long in psychosis.
And any other cases? Like
No,
in
not in
burn,
any
we
other
did
cases.
that.
Yes.
In severe burns,
Huh. Yes, you can use the external application in burns, in local
along with
injuries.
internal.
Along with internal. I have narrated a case in last class that there was an arterial bleeding. We were working in surgery OPD emergency duty at DND Homeopathic Medical College. There came a child who was bleeding since morning. Means from here, somewhere from the facial artery, I think she got some prick, and that bleeding was not getting stopped. Okay, arterial bleeding, remember always arterial bleeding. Why we used to give sutures? Because arterial bleeding usually don't stop, because arterial has its rhythm, no? It's constantly contracting and relaxing. That is why arterial bleeding is difficult to stop. So there was some prick, I think, in the facial artery, and the child was bleeding spot since morning. Okay, and if it was going on for 2-3 days, the child will die of hypovolemic shock. Okay, don't take this kind of arterial bleeding lightly. So we diagnose that it is arterial bleeding and needs some advanced care, but we were going to refer the patient to any state hospital for treatment, but thought suddenly to use ferrum phos 3x or 6x powder and put it there. Okay, in the hole the patient was having, a tiny hole patient was having, we crushed some tablets of ferrum phos 6x or 3x, I think, and we put it in that hole and asked the patient for to wait for half an hour, and the bleeding was gone. Okay, so this was totally a case of external application with the ferrum phos. The arterial bleeding usually stop with the powder of ferrum phos. Okay, so you can try it, this external application also. In injuries, you are at liberty to use external application. We are using, we
On
were
the
there,
cut
we were
sides too,
using.
sir.
Yes.
Can we apply it on cut sides too? मतलब, the skin
Yeah,
is
on the side.
exposed.
Yes. Yes, on the side. On the cut side. No, on the cut side. If the bleeding is there, you can apply ferrum phos powder 6x or 3x. Okay.
It,
If
okay.
there is bleeding. But if there is only cut, bleeding have stopped and cut is there, calendula, apply calendula, it will promote primary healing. Healing with primary intention.
Mm. Okay, sir. Thank you, sir.
Okay. Thank you. So we have completed 199 and we're still not out. We will start from 200 in the next class.
Okay, sir.
Okay. Thank you.
Thank you, sir.